Alright, hello everyone. My name is Dwight Brothers, nursing student at Bellarmine University. I'm going to be showing you how to use any type of rolling bandage today. So we'll start out with this a gauze bandage. So it's got a bunch of different uses. We can use it to wrap a limb, to support a joint, to help hold pressure on a wound, to keep maybe gauze on a wound. Also, something that you can do with this is if you have a large thorax or abdominal wound that needs a lot of packing, this is just a long piece of gauze, so you can peel this apart, and instead of using 24x4s, you can just pack a wound with this, unraveling it as you go. So today I'm going to show you how to wrap a wrist and wrap an ankle, and we're going to use the figure 8 technique, and we're going to both use a gauze wrap like this, and then we'll also use a compression bandage like this. So we'll start out with the wrist here, doing a figure 8. So you always want to start at the more distal part and work proximally.
Again, since his blood sugar was 160.
So we'll start out on the hand, right like this.
10 units.
And so this loose end is called the tail, and you're going to wrap this around. You're going to go through like that. You're going to do that twice to make sure that that stays on.
10 units of air.
And then you'll start your figure 8. So you're going to come around the back of the hand, unraveling as you go,
the 10 units of air,
and then go back around like that. And then you want to make sure that as you're doing this, that your bandage is staying nice and even. It's not bunching up anywhere. And you want to try and cover some different areas as you go around. Make sure that everything's nice and even. Talk to your patient as you're doing this. Make sure that they're not feeling any numbness or tingling in their hand as you're wrapping. Make sure that the wrap isn't too tight.
Then I'm going to label this. So we label it with the patient's name.
And then with the gauze pad, once you're getting towards the end here, since it doesn't have a clasp or anything, you'll hold that there, and then you're going to use tape
2 milligrams per mil. IM route.
to adhere the bandage,
Time every 2 hours.
just like so. So now you have that wrapped. So you're also going to want to now check capillary refill. Make sure that it's less than 2 seconds. You're not cutting off any blood circulation. Talk to the patient, make sure that they can still move everything that they need to move. Make sure that there's no pain there. Okay, so now we're going to do the ankle here, and we'll use an elastic bandage for this. So when you're doing this, you want to start out with the loose end, and with this, because it has the Velcro strap here, we're going to keep that on the outside. And you want to start kind of right along the edge, and then ask the patient to pull their toes up towards their head, and then stay just like that. So you'll wrap that around. Once again, you want to do this twice to make sure that you're holding that tail in place. And now you can start, go around the heel. You want to keep this nice and smooth as you're doing this. Make sure that that's all covered. It's completely covered on the bottom here. And then you're going to start your figure 8.
Good thing we have all day Friday. Or Thursday.
And then once we get to the interior, this particular bandage does have Velcro, so we'll go ahead and stick that to the back, just like that. Making sure that the patient, once again, no numbness or tingling. We'll check for capillary refill in the toes here. Everything looks good. Make sure that there's no pain. And that's how you wrap a wrist and an ankle. Typically, you're going to want to use either a gauze roll or an elastic bandage like this. Those are going to provide your best, going to provide the best support, and also they're going to, hopefully not cut off any circulation of that patient. So if you have any questions or anything, just let me know. Thanks a lot.